All right. So we have been over the last month kind of focusing these classes on interesting kind of movements paired with breath. So it's been kind of a really subtle, um, week might not have been so subtle, but most of it has been kind of a subtle journey with most of the focus on the breath. We're going to continue that tonight with we're going to use pendiculations. And pendiculations are something that when we're looking at movement, we're looking for very, very, very subtle movement. So subtle that you can feel exactly where the movements are going on. Most of them that we're gonna use today are within the spine, and we're gonna use the breath, teaming the breath kind of along with these pendiculations. Pendiculations are used as a way to kind of monitor how your body organizes already. So as we're going through this, you may feel patterns in your body that are natural, that are normal, that you don't have to think about to engage. And then there are others that are going to seem somewhat foreign. And they may be the same pattern, but on the opposite side of the body. This is just kind of a recognition of when something seems normal and easy, that may be your typical pattern. The idea behind it being that we use these pendiculations, and they'll make more sense as we start to work through them, but we use these pendiculations to introduce movement subtly into the body and into the nervous system with the intent of re-educating the body. And rather that be by showing the body what it already does, or rather it be introducing to the body to something that might be helpful. So just be very aware as you move through these, and think less is more. So with that, we'll use have the blanket close by, and then come onto your backs. So you're going to start in constructive rest position. So knees bent, feet wider than the hips, and allowing your knees to rest towards each other. Most of these cues should be really familiar to you by now. So take a moment to see if you can begin by just thinking, can I remember the cues? So finding the back of the body heavy. And then remembering the chin is moving towards the neck and up towards the throat to make the back of the neck long. The broadening across the front of the collarbones, or if it helps, that recognition of the collarbones creating a smile, that smile where the ends, where the collarbones meet at the shoulder blades, slightly lift and then spread across. Bottom of the rib cage is relaxed down. So instead of flaring up, and in this relaxed position down, you may feel the back of the rib cage connected to the floor. But the lumbar spine is slightly lifted away from the floor. So the lower spine, or the lumbar spine, stays in neutral. The front of the hip points align with the back of the hip points. So if you think of the bowl, your pelvic bowl, it's neither tilted forward or back. The contents are staying within. So the front and the back are in neutral. Last week, we talked about the zone of opposition, where the pelvic bowl mirrors the bowl at the bottom of the rib cage. And once you find all of these things naturally starting to integrate into your body, relax. So noticing if you're overexerting anywhere to create the cues, can you maintain the cues, but find a sense of release, find a sense of relaxing? And keeping your jaw relaxed, the tongue resting on the roof of your mouth with the tip of your tongue where your gum line meets the top of your teeth at the top of your mouth. So the tongue is creating the support of your nasal cavity. And today, we're going to begin with our awareness focused on the exhalation. So just don't think too hard on the inhalation. Allow the inhalation to become a natural response to the exhalation. So as you begin to bring awareness to your exhalation, notice the natural tendencies of your exhales. Are they long and smooth and even? As if you are allowing the air to slowly release, almost as if you're releasing the air out of a tire. So it's a slow, gentle release. Or do you feel like your natural tendency is to force the exhale out so that you can take your next breath in? Is it rough and jerky or smooth and even? And as you start to bring awareness to it, does this start to shift? Can you hear your exhale? And as you allow your mind to stay connected to your exhale, begin by trying to create that slow, subtle, light release of the breath. So again, kind of as if you're allowing the air out of a tire slowly. Allowing the breath with each exhale to become a little bit more quiet. So if you can hear your breath, can you gently allow the next breath to be a little bit more quiet? Start to notice what happens as you slow down your exhale. And if you feel the sense to breathe a little deeper, allow yourself, like don't allow yourself to go into panic or anxiety, but if you do need to take a deeper breath in the next time, see if you can come back into that slow, gentle after a breath or two. And as you settle your mind into the space of exhaling, of letting go, of release, you may notice a soft and gentle pause that begins to occur naturally at the end of the exhale. Allow this to happen naturally. So if it doesn't happen right away, just continue to work on slowing it down, making it lighter, making it quieter. But if this pause begins to occur naturally, how long can you stay in the moment of the pause before the next inhale slowly arises from that pause? And as you move from that subtle pause into the next inhalation, we shift our awareness now to the inhalation. What is the state, the quality, the depth of the inhalation that follows? The letting go of the exhale, the being present in the release. And slowly walk your feet so your feet are in line with your sit bones. Bring your hands to the bottom of your rib cage. And your hands in this position are there more as just a feedback to sense no movement in the rib cage. And so we're going to start by doing some very subtle pelvic tilts. So we're targeting the lumbar spine and the pendiculations of beginning with flexion in the lumbar spine. So we're not going back and forth. We're going to start by just doing flexion of the lumbar spine. So the ribs don't move. As you exhale, so staying with that slow and subtle exhale, start to tilt your hip points up towards your ribs to feel your lower back push towards the floor. So we're going into flexion. And then let it come back to neutral. So we're not going into extension yet. We're just working with flexion. So it's a very subtle movement. As you come back to neutral, take a normal breath in and a normal breath out. Take a normal breath in. This time, trying to create that long, subtle, slow exhale, tilt the hip points towards your ribs. The ribs don't move down and in. They stay where they are. So use your hand as feedback to creating a slight crunch. And then let it come back to neutral as you inhale. Stay in neutral as you exhale. Normal breath in. And then again, that slow, subtle exhale as you create flexion in your lumbar spine. So only the low back is pressing towards the floor. The mid back doesn't move. The ribs underneath the hands don't move. As you inhale, let it go, come back to neutral. And we'll do this one more time. So you're keeping all of your cues. The only region of your body that is moving is with the exhale. The hip points moving towards your ribs, so creating tension in the muscle on the front of the body to push the lumbar spine towards the floor, creating flexion. As you inhale, let it go and come back to neutral. And just pause here for a moment, feeling what it feels like to come back to neutral. So this is us teaching the body, like, how to refine neutral when our lumbar spine moves into flexion, and kind of recognizing, was it easy to move into the flexion, or did you have to really think about keeping it just in that region of the spine? Do you find that your tendency is to use the thoracic spine, the rib cage, to create movement in the lumbar spine? So now we're going to go into extension. So again, the hands are on the ribs don't move. This time the front of the hip points are moving towards the tops of your thighs, as now you lift the lower back off the floor. So you're using the muscles of the spine to create extension in your lumbar spine. And go ahead and come back to neutral. Exhale the breath out. As you inhale, ribs don't move. Tilt the hip points towards your thighs, creating extension in the lumbar spine. Exhale, release it back to neutral. So you're not pressing the low back down, finding neutral spine. Normal breath, exhale out. And then as you inhale, again, finding extension. Notice what your ribs are trying to do, and can you maintain the rest of your spine in neutral as you move into extension, and then release. Back to neutral. And then one more time, creating extension, hip points move towards thighs, ribs stay where they are. So creating extension by moving the lower back muscles, not by pressing the ribs forward. Come back to neutral and pause and just kind of notice what you feel. Was that common? Was that recognized with your body, or did you have to kind of think through it? And so now we're going to go back and forth between flexion and extension, but with a pause in the middle in neutral. So keeping your hands on your rib cage, ribs don't move. Inhale. As you exhale, start to tilt the hip points towards your ribs, not pushing the ribs down, but instead using the front core muscles to pull the hip points up towards the ribs. Inhale back to neutral. Exhale the breath out. And we're going to go into extension, so ribs don't move. Hip points push down towards the thighs, feeling the muscles along the spine create extension in your lower back. And exhale back to center. Inhale to prepare. Thoracic, ribs don't move, hip points move. So you're going to feel your muscles in the front of your body create that crunch in your abdominal region. Inhale back to center. Exhale. And then on the next inhale, move into expansion without flaring the front of the ribs. So hip points pull down, the muscles of along the lumbar spine create the extension. And come back to neutral. And just allow your knees to move side to side. So creating a little bit of release in that subtle movement that sometimes seems like a lot is going on. We're going to do the same thing in the upper body. So keep your hands on your rib cage. So the ribs again are not moving. I'm going to come up and just kind of show you what you're going to be doing so you can watch. The movement will be with the neck region and your upper back. So you will be doing this on the floor, but you'll do a rounding of the shoulders, which is flexion in the upper spine. We'll do that a few times. And then as we move into extension, you'll bring the shoulder blades together. Again, that region of the lower ribs will not move. So keeping your hands on your lower ribs. We'll start with flexion of the cervical and upper thoracic region, so upper back region. Inhale. As you exhale, start to round your shoulders and not lifting your head, but making the movement and the muscles as if you were going to lift your head off the floor. And exhale, release. Inhale in neutral. And as you exhale again, rounding the upper back as if you were going to lift your head off the floor, but don't. And exhale, release. Inhale in neutral. And exhale again, round. And just notice what this feels like in your body. How does this movement feel? Let it go. And back to neutral. Does it feel natural, or is this something that you have to work at? And again, one more time, exhale, round, as if you were going to lift your head off the floor. And then exhale, release. So moving in the opposite direction. So now we're moving into extension. Hands stay on the ribs. It may help to bring the hands down. So if you can maintain that awareness of your middle thoracic or lower rib cage area not moving, you can keep it there or bring them down. So inhale. As you exhale, squeeze your shoulders together and slightly tilt your chin back so that you're taking your neck into extension. You can look up at the wall behind you and then let it go. And take a normal breath. And then inhale to prepare. And exhaling, keeping the exhale long, shoulder blades come together and up as your head arches back slightly. Notice the tendency, I just did it. What happened to your ribs with your hands not on your ribs? So do this a couple of more times. Can you keep it just in your upper back and your cervical spine, so your neck region, without pushing the ribs forward away from the floor? Always coming back to neutral, just to notice, giving the body time to kind of recognize these movements. And then going back into it. What is your body's natural tendency to create this movement in your upper body? And again. And let go. We're going to combine these two movements together. So bring your hands down beside your body. We'll start it in the lumbar region and let it move up into the upper back and neck region. We'll start with flexion. So inhale. As you exhale, start to take the hip points towards your ribs. Ribs stay down. And then lift the head, curl the head and shoulders off the ground. So it's just a mini crunch. Exhale as you release down. Pause in neutral. Notice if your hips, if your low back went into neutral, or did you have to think about going back into neutral? So what is your body's natural tendency? My natural tendency was to stay in flexion in my lower back as my upper body went back into that neutral. So find neutral throughout. Inhale. As you exhale, hip points move towards ribs, ribs stay down and in, head and chest curl up, shoulder blades come off the floor. And exhale, slowly release. Feel your body organize into neutral. What happens automatically? What do you have to think about resetting? I'll do two more of these. Inhale. Feel the hip points move up as you begin your exhale, curling all the way up, chest rounds, upper back rounds, chin towards chest, and then slowly releasing back down. and giving a moment for the body to come back into that neutral state. Finding your cues in between each, and which ones do you have to think a little bit more about. Last time, inhale. Find the lumbar crunch, and then flexion in the upper back and neck region. Exhale, lower all the way back down. And moving into extension, we'll use bridge pose here. So hands down beside your hips. Go ahead and snuggle your shoulder blades closer together. Inhale. As you exhale, start the movement by tilting your hip points towards your ribs to peel your hips off the floor. The head doesn't arch back, but eyes reach back, creating a little bit of an extension in your upper spine, and then lowering down. Inhale. Exhale. Inhale to prepare. As you exhale, start to move your hip points towards your ribs to peel the hips off, and then hip points move towards the thighs, taking the spine more into extension. Letting it come up your spine, then even slightly into the neck without taking the neck into total extension. Exhale and release. Allow your body to settle in neutral. And 2 more times. Inhale. Moving on the exhale, start to peel hip points towards thighs as you lift the hips, lift the ribs. Back of the front of the ribs still moving towards the hips. Allow the extension to happen in the spine without the flaring of the ribs. And then slowly lowering back down, finding neutral. And then doing one more on your own, thinking of the movements that are linked together to create this movement into extension in your lumbar spine, into extension in your upper spine, the neck. And releasing, coming back into neutral. And again, allow your knees to move side to side. And so feet hip distance apart, feet hip distance apart, still on the floor. We're gonna bring some cross-body movements into the mixture here. So start with your right hip and slide your right hip up towards your right shoulder blade. This will automatically take your left hip down. So you're creating a side crunch on your right lumbar region. And come back to neutral. Allow it to settle. So we're going to stay on the right side a few more times. Let the exhalation guide the movement. Right hip slides up, left hip slides down. Ribs stay in that neutral position. Coming back into neutral to feel it. Noticing this is something that our bodies will tend to do. So just kind of notice, does this feel like a natural thing, or do you have to think about it? Do it a few more times. It's happening in the lumbar, the lower back region. So it's not all the way up your spine, just kind of stopping where the lower ribs are. Each time you come back to neutral, just notice how that movement feels in your body. So we stay on one side at a time just to kind of let that wander into our awareness. Come back to center, and then we'll go to the other side and do 4 rounds on the other side. So as you exhale, allowing your left hip to glide on the floor, kind of moving it up towards the left side of your rib cage. So doing a little side crunch and then allowing it to come back to neutral. And just keep doing this, and allowing the movement to happen with that long exhalation. And each time pausing in neutral, just to feel how that feels in your body. So we start to recognize patterns. It's very common that we will have one hip that is higher than the other. A lot of times we may be told that we have a leg length discrepancy, that one leg is longer than the other. And although that's possible, it's actually pretty rare that there's actually a bone length discrepancy unless you've had surgery, like knee or hip replacement. Typically, it's just that one hip lifts higher based on postural. So notice if you feel that this happens a little bit more naturally on one side than the other. And this pendiculation, these slow, subtle movements can start to kind of make the body aware that it does that and maybe re-educate it. And come back to center. So we're going to start to combine this with some cross body movements. So we'll go back to the right hip. Allow the right hip to slide up towards your left shoulder as the left hip glides down. From there, inhale. And as you exhale, roll your left shoulder off the floor, and as if you're doing a little side crunch towards the right hip. So the right shoulder and right hip, or right shoulder, left shoulder and right hip are kind of moving towards each other. Roll back down, allow the hips to come back into neutral and the shoulder to come back to neutral. Pause here and notice what it feels like. And then see if you can time these together. So as the hip lifts, can you roll the left shoulder towards the right hip? Come back down. And repeat this pattern a few times. You're moving on the exhale. You can use that long sustained exhale, that kind of slow release. And then pausing each time you come into neutral to see how naturally your body goes back to neutral, or if you have to kind of remind your body how to go back to neutral. And try this one more time. Noticing also as you repeat this pattern, does it get easier? Does your body start to learn how to go back to neutral, or does it stay in that pattern? And return to neutral and just pause. Noticing how that X kind of feels across the body. And then we'll go to the other side. So starting first, lift the left hip up towards the left shoulder blade. Notice what the ribs are doing, and then start to cross right shoulder towards left hip. So creating that kind of side crunch. And then come back to center and bring everything back into neutral. We're always coming back to our cues and timing it with an exhale. Now start to move hip up and shoulder across at the same time. And come back. And repeat this pattern several times, making sure that you allow that moment between each time to come back into neutral, so that you recognize, does your body actually come back into neutral, or do you have to consciously go through your cues to make sure that that neutral is happening? You may also notice that this is a more familiar pattern that you felt on the other side, or a less familiar pattern that you felt on the other side. So all these things, you're educating yourself of your common patterns. At the same time, you're educating your body of its common patterns, and the nervous system is really interesting, and that it learns from these subtle patterns. And sometimes it will automatically start to reset those patterns. So after your next time, come back to neutral, pause, and just notice what you feel. Notice where the spine is in your lumbar region, thoracic region. Is your chin tucked, neck long, collarbones wide? Lower back off the floor, bringing your hips front and back in neutral. When you're ready, roll over onto either side and come up to hands and knees. So in those positions, we used the floor is feedback. We're going to do some similar movements on hands and knees, but trying to keep that same subtle awareness. And this is where I had the blocks. We are going to be in this position. So it is fine if your wrist hurt to bring your elbows to blocks. So that's why I had the blocks as an option. So wrist underneath your shoulders, knees underneath your hips, toes tucked. If this is too much for your toes, you can point your toes back. You'll get a little bit more stability if your toes are tucked. And take a moment to just allow your cues to kind of settle into your body. Chin tucked, neck long, collarbones wide. Lower ribs in. We're finding that zone of opposition between the mirror of the pelvic bowl to the bottom of the ribs. Front and back of the pelvic rim are in neutral. And let's see if without the hips being on the floor, can we find just that movement in the lumbar spine? So there is a slight movement as you exhale. We'll do flexion first. So we'll start with flexion a few times. So think of just taking your hip points up towards your ribs without moving the ribs in. So it's not a cat and cow. And then as you inhale, come back to neutral. Exhale totally. Inhale. And then as you exhale, just moving the hip points up towards the ribs without moving the bottom of the rib cage. Let it come back to neutral. And do this one more time. So inhale. And as you exhale, creating that small crunch in your abdominal muscles that create flexion in just the lumbar region. So the shoulders don't move, the ribs don't move. Coming back to neutral. And then doing the opposite. So moving into extension in your lumbar spine. You'll feel this movement in your muscles along your spine, still using the hip points as that kind of reference. The front of your hip points as you inhale tilt towards your thighs. There's not a lot of movement in your pelvis. It's more the muscles along your spine, creating that slight lumbar extension. And this is a tricky one for me. I really want to use my ribs to create more movement. So resist that. Try to keep the ribs in that neutral position. So again, as you inhale, tilt your hip points towards your thighs. Resisting the urge to over-exaggerate to create more movement. And back to neutral. One more time, hip points towards the ribs or towards the thighs, and back to neutral. Taking this just into the upper back. So the neck and the upper back kind of above the shoulder blades. You want to allow your elbows to bend slightly out to the side. Keep the lower ribs down and in. So the bottom of the rib cage doesn't move. It's just the upper rib cage. Inhale, drop the chin towards the chest. And as if you're trying to push just the top of the spine up towards the sky, you'll create a little bit of that closed chest. And then come back to neutral. Pausing in neutral. Exhaling fully. And then as you inhale, again, finding flexion without the bottom of the rib cage moving. Can you keep it just in that upper back area and neck region? And come back to neutral. One more time. Exhale to prepare. And then inhaling, finding flexion in the upper back. Come back and noticing what your body's tendency is to kind of assist with that. It's kind of what the purpose of these exercises are. How much do we compensate with different regions of our spine to create movements that can happen in the individual regions of the spine that actually sometimes tend to be the areas that get kind of gunked up and trapped. So creating these pendiculations to re-educate the body, to let the body know, can have some help. So elbows stay light. Now we're going into extension. So that middle thoracic region stays stable. Inhale. As you exhale, the neck slightly lifts and the space between your shoulder blades gently sinks down towards the floor, but the bottom of the rib cage does not. And the shoulder blades will come towards the spine to help create that extension. Come back to neutral. And take a normal breath. Release your exhale. Elbows slightly bent, and as you inhale, start to find extension just in that upper region. So shoulder blades glide gently towards the spine. You're not forcing it, because if you force it, the lower rib cage will definitely flare. And then come back to neutral. Stay here as you breathe out. And then as you inhale one more time. Let it go, come back into neutral. Sit your hips back towards your heels, rest your forehead on the floor, just taking a moment to kind of release all that subtle awareness, really let the mind relax, as well as letting the breath rock a little bit of side to side. Come down onto your belly. We're going to start with the right hand in line like under. So your forehead's going to be on your right hand. Your left hand will be above. So it's kind of out of the way. So stack your forehead on your right hand. Find your cues, chin tucked, neck long, fronts of the collarbones wide, lower ribs down and in, front and back of the pelvis in neutral. So press down through the fronts of your feet. And we're going to do some crunches, which is just that transverse abdominis will be working here. So breathe into your belly, feel the belly expand towards the floor. And then as if When you do that slow, subtle exhale, can you sense that your pubic bone and your ribs are coming together or towards each other? And this will lift the belly slightly away from the floor. So just take a few breaths, creating this awareness. Letting everything go, the inhalation coming in naturally, so not trying to force it to be big. But as you exhale, that slow, subtle exhale out with the awareness of the pubic bone or the hip points and the ribs drawing towards each other. You may feel, as you do this, the tops of your thighs and your feet pressing down. You may feel a little bit of the glute engagement. So these are all things as we're moving into the back bends that we want to feel, but sometimes they don't happen naturally. Come back to neutral. And so we did that cross body pendiculation on the front of the body. So this is one for the back of your body. So inhale. As you exhale, create that same awareness of the front of your body. So hip points and ribs moving towards each other, belly off the floor. Keep that awareness. And on your next inhalation, lift your head and your hand stays on your head. And then slightly rotate the right elbow open as you lift your left leg. Exhale, come back and refine neutral. A normal inhalation in. Exhaling, feeling front of the core. So hip points and ribs come towards each other, thighs press down. And as you inhale, lift your head, hand stays on your head. Lift your head, start to tilt, elbow up towards the sky as you lift your left leg. And release. Let it come back to neutral. Each time as you do this, start to notice what you feel in your body. Is that an easeful movement? Is it something that you have to organize each time? Think about. Do this 2 more times. Now on your next exhalation, ribs draw down and in, pubic bone presses down, hip points up. And as you inhale, lift your head in your hand, rotate elbow up towards the sky, so slight twist as you lift your left leg. Let it go. Pausing in neutral, letting your breath return to normal, allowing your body that sense of coming back to neutral, of letting go. And then one last time. So regular inhalation in. Finding your front body engagement as you exhale. Keeping head and hand together as you lift the head off the floor and rotating elbow up towards the sky as you lift your left leg. Releasing back to center. Switching your hands, so now your head rests on your left hand. Allowing your hips to wiggle side to side. And then let's engage on the opposite side just to see if you notice anything. So normal breath in. As you exhale, that front body crunch. And keeping head and hand together, lift the head off the floor. Start to rotate elbow open to the left as you lift your right leg. And then exhaling down. And take a pause in neutral. Starting to recognize the difference between the right and left side, if there is a difference. Normal breath in. Finding the front body crunch as you exhale, so setting up. Inhaling, lifting head, hand as you rotate open to the left, your right leg lifts. Can you feel that cross body across the back body? And then lower down. And 2 more opportunities for our body to experience this cross body extension. So regular, normal breath in. Finding the front body as you exhale. Keeping that as you start to lift into extension, rotating left elbow up, twisting upper body towards right leg lifted, and releasing. And one more time, finding these things on your own. Stack both of your hands underneath your head. Shift your hips side to side. Let everything go in stillness and neutral for a moment. And then bringing it all together. Keeping both hands stacked underneath your forehead. Take a normal breath in. Exhaling, find that front body engagement. Inhaling, keeping both hands attached to the head as you lift the head and the chest from the floor, both legs lift. Pause here for just a few breaths. Trying to keep your breath kind of light and relaxed. Noticing if you can breathe deep in your lungs. You can find your cues throughout your body and release down. And taking your feet mat distance apart, and let the hips shift side to side. Bring the hands underneath your shoulders, press up. It's coming back into hands and knees, taking this onto the knees. So this is where you will potentially need your blanket. And so kneeling with both knees on your blanket, take your right foot forward. So coming into a half kneeling position. Take your right hand across to your left shoulder and then your left hand in front. So elbows kind of stack on top of each other. So in this position, now we're moving into this region of the spine that we haven't really been moving at all. So we've moved the upper thoracic and neck, and we've worked the lumbar. So in this position and in kneeling, our lumbar stays kind of in neutral, and our hands in this position help to keep that feedback of keeping the upper back in neutral as well. So starting moving to the left, do some little side crunches. So inhale. As you exhale, tilt as if you're pushing your rib cage out, the lower part of your rib cage out to the right as you tilt to the left. Come back up. And again. So do this a few times, just noticing what is the tendency to move into your upper body, that upper region, or your lower region to help create that mid-thoracic movement. And come back to neutral. Let's do flexion and extension. So flex, rounding just the mid back. And then coming up. And coming just into the mid back. So pushing the fronts of the ribs back to create a little bit of rounding in your mid spine. And come up. And then round. Come up. And then back into extension. So the opposite way. So the lower ribs are not pushing forward. Try to create it more in the back of the lower back rib cage. So sustaining some tone in the front of your core. And then for rotation, we're going to take the two moves together. So start by rotating down to the right and up to the left. So as you inhale, you're rotating up and to the right. And as you exhale, you're rotating down and to the left. Bring your hands to your hips. Lean onto your left leg. Just start to tap your right foot off the ground. See if you can keep, as I start to try to show you, your hips over your shoulders over your hips. Can you keep your outer left hip moving in? And you may just get a second. The next time your right foot lands, step up to standing and cross right shoulder, left. Feet about hip distance apart. Let's put those moves together. So hips stay stable. So we used being and kneeling to feel that sense of stability in the hips. Move into flexion, so rounding forward. And then rotate to the left. Rotate back and rotate to the right. So try to keep this movement all in your mid spine. So notice your tendency for your body to move into your hips to create this rotation. Can you keep the hips stable still as you find each of these movements in your spine? And we're going to go down back to the floor, now with the right knee on the floor and the left leg forward. So this time, left hand comes across to right shoulder crosses in front. So staying in this half kneeling position helps to keep this shoulder stable, or the hip stable. Hands on the shoulders help us to keep our shoulders from rounding. And just start by moving into that lateral side bend. So side bending first to your right. Notice what your body tries to do to create this movement. Does the hips try to shift to the left? Do you try to round your left shoulder forward? Can you keep it just in that shifting of your rib cage to the left? And coming back up and finding flexion. So moving the rib cage, the bottom of the rib cage back to find the rounding now in that mid spine. And come up. Can you use your breath to help to create this movement? And then finally, extension. So notice the tendency to push the ribs forward. Can you move instead as if you're trying to create extension, like you're stretching your sternum up towards your collarbones without flaring the ribs forward? Come back to neutral and we'll move into the rotations. So you'll twist down towards the right, and you'll twist up and open towards the left. So inhaling as you twist up and open to the left, and exhaling as you twist down and over to the right. Notice what's going on in the hips. Notice what's going on in the upper back. Can you keep this awareness just in that mid-thoracic area? Come back to center. Hands on your hips. Using your right hip moving in. So try to push the hip in. Start by coming up on your left toes. Shoulders stay above your hips. And just start to slowly test the waters of lifting the left foot off the ground. Noticing what's going on in the hips and the spine to kind of organize that. Keeping your awareness on that outer right hip. Touch the foot down. Press up. Left hand across, right hand across. And we'll twist in the opposite direction. So feet are wide. Not moving the hips, tilt to the right. Keep the hips where they are, move back into extension to the left and forward. And then starting to move with awareness of that region right along the bottom of your rib cage, all the way around, to create this movement from that area, rather than relying on the movement of the hips or the upper region of the spine to create the rotation. This sometimes can be the most locked up region of the spine. So just noticing, is this easier to move in this direction? Was it easier to move in the other? Or do you find both easy or hard? And come back to neutral, hands down. We'll finish with just a forward fold. So feet hip distance apart. Reach your arms over your head. Send the hips back, so push the hips back as you hinge from your hip creases, knees bent or soft, and allow your hands to rest on the floor. So bending your knees if you need to get your hands to the floor. Let the crown of your head hang and come back into that awareness of your slow, subtle exhales, where the inhalation is a response to your exhale. Press the fingers down, bend the knees, lift up. And then come down onto your knees and sit back on your heels. Resting with your eyes closed, just to kind of absorb the effects of the practice on your body. Noticing how your spine feels, how your breath feels, where you are now naturally in space in relation to our cues that we use week after week. Or better thought may be, is your zone of opposition becoming a little bit more natural? Is your breath becoming a little bit more at ease, quiet, low, and slow? So hopefully this month of slowing down and taking this really focused approach on the breath, a really focused approach on those subtle movements that make such a difference when it comes to motor control. Hopefully some of this has kind of woken some things up, at least piqued your interest. So I thank you for this time. Namaste.